Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week, we're talking about breast cancer early detection and treatment options at St. Luke's. I'm here today with Dr. Ruby Marody, breast radiologist at St. Luke's Cancer Institute. Thank you so much for joining us today.
Thank you so much for having me.
Well, 1 in 8 women are diagnosed with breast cancer, and nearly 1 in 39 die from their diagnosis. Catching breast cancer early can make all the difference in a patient's treatment and outcome. Can you tell me a little bit more about why early detection is so important?
Early breast cancer detection often translates to better treatment outcomes and more lives saved. Since the widespread use of mammography in the early 1990s, deaths from breast cancer have decreased by nearly 40%. Here at St. Luke's, we offer the most advanced imaging technologies, 3D mammograms, and fast breast MRI, both proven to help increase cancer detection. We also only employ fellowship-trained breast radiologists because studies show that specialists find more cancers at earlier stages.
So what advanced treatment options does St. Luke's offer for patients?
We meet patients wherever they are in their cancer journey, whether newly diagnosed within the system or they transfer their care to St. Luke's. Some patients do need advanced care, like at the Center for Precision Oncology, where they use the latest in genetic sequencing to analyze and identify patients' specific cancer mutations to create personalized treatment plans. We also have an agreement with Washington University in St. Louis, offering the patients the latest in clinical trials.
Great. So when a patient is treated at St. Luke's, what's their care team made up of?
Each patient has a comprehensive breast care team that may include fellowship-trained breast radiologists, pathologists, nurse navigators, genetic counselors, specialized breast surgeons, medical oncologists, and or radiation oncologists. This specialized team creates a personalized treatment plan for each patient so that we treat young women with aggressive cancers very differently from our elderly patients with slow-growing cancers. We use the most advanced technologies so that we not only catch breast cancer early, but we treat breast cancer completely at every stage.
According to Metastatic Breast Cancer Network, approximately 6 to 10% of new breast cancer cases are initially stage 4 or metastatic, and it's estimated that 20 to 30% of breast cancer patients will become metastatic. St. Luke's has a specialized center for these patients. Dr. Marody, can you talk to me about that?
The St. Luke's Hospital Kuntz Center for Advanced Breast Cancer is the region's only center for treating metastatic breast cancer. They not only use advanced genetic sequencing and immunotherapy, but they address the whole person by offering emotional support services, nutrition planning, palliative care, and spiritual counseling. Many facilities will treat this diagnosis as a death sentence, but at the Kuntz Center, women are treated with respect and compassion and taught how to live with the diagnosis and enhance their quality of life.
Now, hearing the word cancer can be so overwhelming. What types of support does St. Luke's offer for these patients?
So our oncology supportive and rehabilitation services provide extensive practical resources and emotional support to patients in assisting from diagnosis, treatment, and beyond. We have nurse navigators who help coordinate patients' care. They serve as a personal resource and advocate for the patient. The Kuntz Center has retreats with other women and families who are living with metastatic disease.
Now, what else sets St. Luke's apart from other programs?
Our comprehensive breast care team takes the time to truly know our patients so that we can care for them not only physically, but mentally, emotionally, and spiritually. Our team offers the highest level of care at a deeply personalized level. For example, many physicians and staff members know the names of patients' family members, and they ask about unique life events outside of the breast cancer journey. Here at St. Luke's, we don't just treat a patient's breast cancer. We care for the whole person.
Great. Well, thanks for joining us today. If you'd like to find out more about breast cancer or St. Luke's Cancer Institute, visit stlukeskc.org/breast cancer. You can also stay up to date with all the latest developments on the COVID pandemic and other health news from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.